A pleasant day to everyone. My name is HGN Berdine, and I'm a second year student taking a Bachelor of Nursing in ACU. And today, I'm here to present my understanding about Parkinson's disease and generally discuss its pathophysiology and a medication and how to manage it. So, here are the four learning objectives in this presentation. The presentation will first start off with the overview of the illness, then the pathophysiology. The third one is pharmacological treatment, and finally, nursing interventions that are linked to Parkinson's. So without further ado, let's jump in straight to the presentation. So what is Parkinson's disease? So it was first discovered by James Parkinson in the year 1817. So initially, the disease was described as the shaking palsy. Parkinson's disease is a long-term neurodegenerative disorder in which there is a progressive brain degeneration leading to increasingly severe symptoms. It is most well known for its effects on muscular control, balance, and mobility. However, it is also have other impacts on a person's senses, cognitive function, and mental health. Moving on to the next slide. The actual reason of the breakdown of nerve cell that leads to idiopathic Parkinson's disease is yet to be discovered. First on the list would be gender and age. Those over 50 are more likely to get Parkinson's disease. This condition affects people of all ages and ethnicities. Although statistically speaking, men are 1.5 times more likely than women to have Parkinson's disease. So next up will be genetic susceptibility. Researchers have found defective genes that may cause Parkinson's in certain individuals, but there isn't enough evidence to conclude the condition is always hereditary and only affects a small percentage of the population. The last would be environmental factors, which include things like head injuries and exposure to pollutants such as herbicides and pesticides. Parkinson can be easily identified by motor symptoms. These symptoms develop slowly and often attributed to old age patients. We can easily remember it by using the mnemonic TRAP. These four core motor features include T for tremor, R for rigidity, A for akinesia, and P for postural and gait disturbance. Next slide would be pathophysiology. So let's begin by taking a closer look at the bottom of the image to understand the pathophysiology of Parkinson's. So the yellow part that you can see is a substantia nigra, and this area of the brain becomes pigmented as we age. Normally, we are born without pigment in this area, but when we hit puberty, it slowly becomes pigmented, and once a person acquired Parkinson, you lose that pigment, which is due to loss of neurons in the area of the brain. In this slide, we are looking at the flow chart, so this helps us understand better the symptoms of PD. And most symptoms of Parkinson's are caused by a lack of dopamine due to the loss of dopamine-producing cells in the substantia nigra of the midbrain. And when dopamine is too low, it disrupts the normal balance between dopamine and acetylcholine in the basal ganglia, which then impairs a person's motor control. And by the time clinical manifestation occurs, approximately 85% of dopaminergic neurons are lost. Then patients who have Parkinson can experience involuntary movements such as tremor, rigidity, and akinesia. Next slide would be treatment and management of Parkinson's. So symptoms worsen as condition progresses over time. So it's really important to seek professional help and discuss with your doctor about medication to prevent this disease to worsen. Again, there is currently no cure for Parkinson's disease, so treatment is aimed at delaying the onset of motor symptoms, thereby extending the quality of life. So in this specific slide, I have here 5 medications that is prescribed to patients diagnosed with PD, but we aren't going to go in depth in each of the medication. What we'll be focusing is a medication called carbidopa-levodopa. So the drug's trade name is Sinemet, which is converted to dopamine in the brain. So this belongs to a class of dopaminergic antiparkinsonism. Thus, the way that carbidopa-levodopa works, carbidopa stops levodopa from breaking down before it even reaches the brain, whereas levodopa breaks down before it enters the brain. When levodopa and carbidopa contact the cerebral cortex, they boost dopamine levels, which reduces Parkinson's symptoms. Basically, levodopa functions similarly to the chemical called dopamine. So people with Parkinson's are treated with this medication to lessen their tremors and stiffness in their muscles. The following side effects when taking carbidopa-levodopa are orthostatic hypotension, depression, dyskinesia, urine discoloration, which is totally normal, and GI. Moving on to the medication contraindications, it is not recommended for carbidopa-levodopa to be taken with MAOIs because this will raise the risk of hypertension, which is really bad for Parkinson patients. So in order to help patients avoid adverse drug reactions, it's really vital to educate them about the medication. So here are the 3 things that they need to know. So first off, as the medication is an extended release capsule, it must be solid as a whole. And remember not to crush or break it. The second one is to stay away from high-protein meals since they reduce the medication efficacy. Lastly, reduce the chance of GI distress. So remember to take medication with food at all times. As we approach the final slide, the following 5 nurse interventions must be completed before, during, and shortly following medication administration. 1 is gather a full list of medications, specifically MOAIs, as they contradict with carbidopa-levodopa. Second is take fall prevention measures, as is happen usually in Parkinson patients. Third, as I already stated, patient education is really important. Fourth, GI problems, so they need to be watched, especially if it's a common side effect. And lastly, watch out for toxicity. Thank you all for watching, and I hope you have a wonderful day.